Good afternoon, and I'd like to call the Subcommittee on Transportation and Public Assets to order this hearing, and this is a subcommittee of the Committee on Oversight and Government Reform. Today we're conducting a hearing on the Zika virus, and we're looking at the coordination of a multi-agency response to that virus. Very pleased to have everyone join us today. The order of business will be as follows. We'll have opening statements. Myself and Ms. Duckworth are here and other members joining us. And we will then hear from our witnesses. And from the witnesses, we will hear your testimony, and then we'll go into questions. That'll be the order of business. So without objection, the chair is authorized to declare recess at any time. And I'll start with my opening statement, and then I'll yield to Ms. Duckworth. Again, I want to thank everyone for attending. There are probably some people that didn't want us to hold this hearing, but I think it's very necessary that we do conduct it. I think that the Zika virus is probably one of the more difficult health challenges that the nation and the world have faced probably since the Ebola crisis. And unlike that particular crisis, there's some very good news to report in this hearing. And then the purpose of the hearing is also to hear from some of those involved in making certain that the public health, welfare, and safety is preserved while we face this possible epidemic. And I might say this isn't something just facing the United States, it's facing the world. So it's spread, again, we know, across many continents. And we have international events like the Olympics this summer in Brazil. We want to make certain that American travelers there are protected. And I might say also we have American personnel throughout the infected area in the world who are our responsibility to make sure they're safe and secure. Many of them are abroad serving the United States in diplomatic posts with the military and others, and we want to make certain that those individuals that we're responsible for are also protected. I'm pleased, too, with the World Health Organization. You've heard me from this dais raise some serious questions during Ebola, that they did not act to alert the public and declare the seriousness of Ebola at the time. That is not the case here. They have acted. They have been proactive. I'm also pleased that we have had a very good response, both from the federal level and the state level and other agencies in government, and we need to keep it that way, and we need to keep going forward. Today, the purpose of this hearing is to see where we are and what we have done and where we need to go and how we can keep this under control. I'm very pleased, too, we'll have a representative from my state, which has taken the lead, and Governor Scott and others. We have our Surgeon General of Florida with us, and we'll hear from, again, NIH. They've done a great job. Center for Disease Control, we'll hear where they are, and give an opportunity to get an update on a great world event, which we're looking at in Brazil later this year. Right now, and I want to say this and make this very clear, there has been no detected Zika infection from an insect or mosquito in the United States of America. No transmission that I'm aware of. Most of what we've found so far are individuals who've traveled somewhere else and come into the United States. This isn't a South United States problem. In fact, right now, and we have a chart we could show later, I think as far as Wisconsin in the United States, and what is it, 23 states have now had cases where they have determined that someone was infected with the Zika virus. So we don't have that infection from mosquitoes in the United States, but we do have people coming in outside who have been infected with that disease. So we still have a long way to go in the detection process. We don't have a vaccination available. We don't know all the connections, and we'll have questions and some directions about where we're going to look at how we can go after the disease, either for vaccination or for treatment. The numbers that we have seen so far are, again, somewhat limited in the United States, but again, getting a head start on it. In Florida, we've had 28 cases, and I think 2 of my counties with a single case. I just had lunch with the local health director, and I thought that was very informative because I wanted to hear from him how things that we are doing here have filtered down to the local level. And I will say that report is also good. But they do face challenges. They want to make certain that they have the test kits available. They want to make certain that the testing is available. They want to know where to go next, and some of that has been provided. And the state of Florida acted in early February, the governor and others, and they have been in close contact with the local officials, which I think is extremely important. There's some simple things that can be done, and we know what they are, is using insecticides and using mosquito repellent, staying in air-conditioned locations, and that, again, is where people are getting the infection. But if we do have the problem in the United States, we want to make certain that people are aware of the risk that they face and the simple solutions to tackle it. It's just like mosquitoes that we have from coast to coast and from border to border. While the CDC remains hesitant to confirm some of the links, and we'll hear more about that, experts are confident that Zika is causing some outcomes that we've seen, and we'll talk about them. The most notable and at risk are women and pregnant women, and they seem to have, or seem to be fairly certain of a link there. We'll find out more about that and other possible links to individuals that may cause them serious health damage. The administration, I woke up at 3 o'clock in the morning to I had this folder and fell asleep reading it. Woke up at 3 and finished it last night. And I did read the administration. Last week, the president sent a communication to the members of Congress and asking for a $1.8 billion request for emergency action. I also read where Mr. Rogers, our chairman of appropriations, said we happen to have almost the exact amount left over from Ebola and the possibility of using that. I want to make certain that the funds are available, particularly for the research, for finding out anything that can stop this, either with a mosquito or keep people safe with possible vaccination wherever we're going to go. But that also needs funding ASAP, and we want to make certain that those funds are available. We'll have some questions about the money flow because money usually solves most of our problems. The situation is rapidly developing and changing, and Americans have concerns, but they need to know that their government on each level, federal, state, and local, are making certain that the challenge is being met, and we want to ensure the public that we're all receiving the latest information and coordinating in good fashion so that we can do the best. The United States is fortunate. We have the world's most advanced healthcare system. in the United States. It's impressive. We want to keep it that way and make certain that we're well coordinated. We use common sense, and that we'll be able to contain the spread of this virus and be well equipped for any future threats it may pose. So I look forward to hearing from the panel. I welcome our witnesses. I'd like to turn to our ranking member, the gentlelady from Illinois, Ms. Duckworth, for her opening comment.
Thank you, Mr. Chairman, and thank you to our expert witnesses for being here today. Today's hearing is an important opportunity to examine the effectiveness of our current efforts to combat the Zika virus and to ensure that the interagency response is efficiently coordinated. There have been 82 reported cases of Zika in the United States, including 4 cases in my home state of Illinois. To date, these cases have been limited to travelers returning to the United States from affected countries or from individuals who've had sexual relationships with returning travelers. As a new mother, I deeply understand the public's concern over the Zika virus. The recent outbreak of this public health threat in Brazil has shed light on a disease of which most Americans are not aware. And as the head of the Centers for Disease Control and Prevention, Dr. Tom Frieden recently explained, even the scientific community, there is an astounding lack of literature examining the Zika virus. Fortunately, our public health community is working hard to change this. Since the last major Zika outbreak in 2007, the CDC developed a test to detect Zika in the first week of an illness or in a sample taken from an affected child. More recently, the CDC activated its Emergency Operations Center last month in response to this latest outbreak, and on February 1st, the World Health Organization designated the outbreak a public health emergency of international concern. Our public health system has acted quickly to increase its surveillance and diagnosis capabilities in affected areas and to ramp up what had been very limited scientific research on this virus. I want to thank the CDC and the NIH for their very hard work and rapid response in this case. However, much work remains to be done so that we can better understand the Zika virus and develop proven strategies to treat affected individuals, to contain the virus's spread, and ultimately to develop effective therapies and vaccines that will neutralize the threat entirely. Further, we must work diligently to assess every available control measure and adopt the most effective policies to prevent the virus from entering the mosquito population in the continental United States. Equally important, in light of what appears to be the Zika virus's capacity to cause severe birth defects, we must also provide safe, effective, and affordable contraception to individuals living in areas of risk for Zika transmission. This includes taking action to strengthen healthcare services in areas where mosquito populations are already carrying Zika, such as Puerto Rico and the Virgin Islands. Zika, like the pandemics before it, knows no boundaries. Our contributions to public health efforts in Central and South America are first and foremost the right thing to do. But they are also critical to controlling the spread of this disease. That's why I fully support the President's proposal for $1.9 billion in emergency funding for the domestic and international response to Zika. I also emphasize that continued consistent investment in public health remains critical in periods of crisis as well as in periods of calm. Our public health agencies are able to mobilize with agility today because they have built on decades of institutional knowledge, capacity, and lessons learned to anticipate and better respond to emerging threats, some of which we've never even imagined. The emergence of Zika should serve as a warning that we must continue to invest in our world-class public health infrastructure to defend us both against this threat and the viruses that will surely appear in the future. Until we have more answers, we all must remain vigilant against Zika. We must all take reasonable precautions so that we give the next generation the best chance at full, healthy lives. This requires the cooperation of both men and women to prevent transmissions to other humans or to mosquitoes in the continental United States. I urge everyone to proceed with caution to protect themselves, their partners, their families, and their communities. I really look forward to this testimony of our witnesses, and thank you, Mr. Chairman, for holding this hearing today. I yield back.
Thank the gentlelady, and if no other members have opening statements, what we'll do is we'll, with unanimous consent, we'll hold the record open for 5 legislative days. Did you have an opening statement? Sorry. Okay, but we'll hold, with unanimous consent, the record open for 5 legislative days for members who'd like to submit a written statement. And we may be asking our witnesses questions in addition to what's done in this formal setting and they'll also be made part of the record without objection. So ordered. Okay, now we'll welcome our and recognize our panel of witnesses today. And I'm pleased to welcome Dr. Ann Schuchat, and she is the Principal Deputy Director of the Centers for Disease Control and Prevention. Dr. Anthony Fauci, and he is the Director of the National Institute of Allergy and Infectious Diseases at the National Institute of Health. Welcome back, Doctor. Dr. John Armstrong, and he is the Surgeon General and Secretary of Health for the state of Florida. And then we have Dr. Bill Moreau, and he is the Managing Director for Sports Medicine for the United States Olympic Committee. I want to welcome all of you, and pursuant to the committee rules, and this is an investigation and oversight subcommittee and committee of Congress, I'll ask you to stand and be sworn. Raise your right hand, please. Do you solemnly swear or affirm that the testimony you're about to give before the subcommittee of Congress is the whole truth and nothing but the truth? Let the record reflect that the witness is answered in the affirmative. And while Dr. Fauci has been here before, maybe others, it's customary to give a 5-minute statement, and if you have additional information or data you'd like to be made part of the official record of these proceedings, to ask through the chair or a member that they be included, and we'll do that. So we will start right out. I want to welcome again the Deputy Director of the Center of Disease Control, Dr. Ann Schuchat. Welcome, and you're recognized.
Thank you so much, Chairman Micah, Congresswoman Duckworth, and members of the subcommittee. CDC and partners here and overseas are working round the clock to find out as much as we can, as quickly as we can, and we are learning more every single day. To accomplish this, CDC is coordinating here at home with others across the Department of Health and Human Services, including my colleague, Dr. Fauci, and we're working with partners across the U.S. government as well as with other parts of the society to make sure that we communicate with travelers and healthcare providers, update travel alerts and clinical guidance, develop improved mosquito control methods, and we're coordinating internationally with the World Health Organization and Pan American Health Organization on the Zika response. We're working directly with Brazil and other nations, and we're all trying to learn more about Zika and help prevent its spread. I want to begin with 3 key points. This is a dynamic situation. It's changing very frequently. We are committed to share what we know when we know it and to revise and adapt to the new information. Secondly, emerging infections come from nature and they can be challenging. A new syndrome like this can be scary, particularly for vulnerable pregnant women. But we can and should do more to detect, respond, and prevent these new infectious threats. Thirdly, CDC has a unique decades-long experience in core public health functions that are critical for this kind of response. We work on emerging pathogens like Zika. We work on disease detection, lab capacity, epidemiology and surveillance, response and partnership with state and local governments and with other countries. What are the facts? Well, we've known about this virus for a long time, but only in 2007 was the first outbreak recognized. We think the virus usually causes a mild syndrome, but we've recently learned that it appears to be associated with serious birth defects, microcephaly, and possibly others. There may also be links with a neurologic problem, Guillain-Barré syndrome. It's principally spread by the Aedes mosquito, a very difficult mosquito to control, and that is one of our challenges. Where is this going? There have already been more than 1 million cases in Brazil. A number of countries in Latin America are seeing sharp increases in Zika virus infections. We expect many travelers returning to the United States to have Zika virus infection, but we are doing what we can to prevent the severe complications. That's why we issued the guidance for pregnant women to avoid traveling to areas where the virus is spreading, because at this time, avoiding the virus and the mosquitoes that spread it is the best way to protect a pregnancy. We expect there may be a little bit of local transmission in the southern United States because the mosquito that carries this virus is resident in those communities. We don't right now expect a lot of local transmission, but we need to be ready for it. One of the reasons that the Florida governor did declare that emergency. We think that other countries are the place where critical information can be learned, and that's why we're working side by side with our colleagues in Brazil and Colombia to learn as much as we can, as quickly as we can. CDC has been very busy. As you've heard, we've activated our Emergency Operations Center to the highest level. We've actually got more than 500 people working on this response, not just our infectious disease experts and our insect experts, but also our experts in birth defects, in communication, in travel health. We have developed and distributed kits for laboratory detection, and we're working with state and local health departments so that they can deploy those tests. We're working on the ground in Brazil and Colombia trying to uncover the mysteries of those links that you were talking about. While we're doing much already, Zika requires a robust all-of-government response, as put forward in the emergency Zika funding request. CDC's part of that request was to provide support to Puerto Rico and other areas in the United States, the territories where the virus is already spreading. Secondly, for the rest of the U.S., where the travelers may be returning and where laboratory capacity and communication is going to be vital, as well as insect monitoring. And thirdly, for our international partners, where we do have a chance to learn as much as we can and to protect Americans in that way. This funding would support CDC's work in prevention, detection, and response. To conclude, we must act swiftly to address the challenge of Zika virus. We're learning more every day, but there's much more to learn and much more to do. And CDC will continue to work collaboratively across HHS and with other departments and with Congress to ensure an effective response. Thank you.
Well, thank you for your testimony. We'll now turn to Dr. Fauci, representing NIH. Welcome, sir, and you're recognized.
Thank you very much, Chairman Mica, Ranking Minority Duckworth, members of the committee. First, I want to thank you for the opportunity to discuss with you and the committee this morning the role of the National Institute of Allergy and Infectious Diseases in the research component of the broader approach towards addressing the Zika virus threat. The NIAID, the institute that I direct, has a dual mandate among NIH institutes. First, we maintain and grow a robust basic and research portfolio in the disciplines of microbiology, infectious diseases, and immune-mediated diseases. However, despite that long-term commitment, we are also prepared and are part of our mandate to rapidly respond to new and emerging disease threats. And this has been something that we have been doing essentially from the beginning. In fact, if one takes a look at this slide, it is the title of a perspective that I wrote last month for the New England Journal of Medicine. And you see from the title, it says Zika virus in the Americas, yet another arbovirus threat. And what I was referring to is that over the past couple of decades, we've seen new diseases of the arbovirus type in the Western Hemisphere that we've not seen before. West Nile, dengue from decades ago, chikungunya in 2013, and most recently in 2015, Zika. When one looks at the role of what we do, if we can go back one, the role of what we do, the NIH's mandate is to do basic and clinical research to provide the research resources for industry and academia with the ultimate mandate to develop vaccines, therapeutics, and diagnostics. So let me take a couple of minutes to just describe some of these. When you look at things like the epidemiology and natural history, we're focusing on looking at symptomatic versus asymptomatic disease. What about the role of virus and how long it lasts in an individual following infection, a question extraordinarily important to pregnant women and women who want to become pregnant? What about cohort studies to actually nail down the causative relationship or not between infection and pregnancy and the development of congenital abnormalities such as microcephaly, as well as understanding the pathogenesis of disease? With regard to basic research, it is very similar to the basic research we've done with other viruses throughout the years, ranging from HIV 30-plus years ago to most recently with Ebola. And that is to look at viral structure, viral pathology, medical virology, the pathogenesis of disease, looking at the immune response, which gives us great insight into the development of vaccines. In addition, as you know, the CDC takes the lead role as disease detectives in trying to determine the diagnosis of a disease, something they're doing right now. NIH grantees and contractors are also working on a more sensitive and specific antibody test to determine if, in fact, someone has been infected, because we know now the current tests that are available have a degree of cross-reactivity. One of the most important things we do is to develop vaccines, as we've done for so many other of these emerging threats. The candidates you see on this slide, the two marked with red, are the two that are most advanced and are essentially ready to go into early trials. We're partnering with our industrial colleagues, and right now, let me give you an example of why it's important to have done decades of research in other diseases that gives us a head start. Years ago, we developed a vaccine for West Nile virus. We went into phase 1. It was shown to be safe, and it was shown to induce an immune response that you would predict would be protective. We didn't have any industrial partners, so we never made it to the advanced development. But we used that platform to develop now a Zika vaccine that is essentially ready to go in the development of the early preclinical studies. And it really is a very interesting phenomenon. We took what's called a DNA piece of genes, and we stuck in it a West Nile gene to express a protein of West Nile. So all we did this time was take that same platform, take out the West Nile gene, and stick in the Zika gene. So right now, we're making this vaccine, and we predict it will be ready to go into phase 1 trial by the summer of this year, and hopefully by the end of 2016, we'll have enough information to decide if we can even go further to an advanced trial, and I'll be happy to discuss that during the question period. Finally, when one looks at therapy, we're doing screening of drugs of known activity against certain of these viruses, as well as new drugs that have potential activity. This is a very important issue, and we are now partnering with many of our industrial and biotech partners to do this. Finally, on this last slide, I just want to recapitulate what I said from the very beginning. Emerging infections have been with us all along. They're with us now, and they will always be with us. I call it the perpetual challenge, as I did in this review from a few years ago. And I would like to thank this committee and other committees for the extraordinary support that you have given us over the years to allow us to fulfill this mandate. Thank you.
Thank you, Dr. Fauci. Now we'll recognize our Florida Surgeon General, Dr. Armstrong. Welcome, and you're recognized, sir.
Thank you, Chair Micah, Ranking Member Duckworth, members of the subcommittee. I'm glad for the opportunity to be here with you this afternoon. Florida has a long tradition of combating and eradicating mosquito-borne diseases. In fact, the Florida Department of Health was created out of an epidemic of yellow fever in 1889. Our mosquito-borne outbreaks in modern times have been local and of short duration. Consistently, the approach has been threefold. First, mosquito control. Next, public information. And third, health professional education. And we have seen success with containment of West Nile virus, dengue, and chikungunya. This afternoon, I'll provide an update on the status of Zika virus in Florida and an overview of how Florida has successfully applied CDC guidelines to protect our residents and visitors. To date, we have had no transmission of the Zika virus in the state of Florida. Through healthcare professional readiness, our department has reported 29 travel-related Zika cases to the CDC, most recently from Seminole County. A travel-related case is defined as a disease that was contracted outside of the state prior to arrival. None of our confirmed cases of active Zika virus involve pregnant women. We have, however, identified 3 pregnant women who traveled to countries affected by Zika and who likely had Zika virus in those countries and who have returned without any symptoms. They have evidence of remote infection with Zika, and we are applying CDC guidelines to ensure that these women receive care through their health professionals consistent with those guidelines. We've had 29 cases in 11 Florida counties, and we currently have the laboratory capacity to conduct over 4,800 viral tests for active Zika and over 1,200 antibody tests to detect past Zika infection. We've been conducting approximately 300 tests for Zika a week and reporting positive results to our partners and the public daily. Recognizing the increase of travel-related cases of Zika in Florida, on February 1st, Governor Rick Scott requested a briefing with the CDC on the Zika virus. And on that call, we confirmed that the Aedes mosquito, the carrier of Zika, is common in Florida and that there are potential links between Zika and newborn microcephaly, as well as adult neurologic disorders, including Guillain-Barré syndrome. What was most clear from that briefing is that there is scientific uncertainty about Zika transmission beyond a mosquito bite and about the impacts of Zika after an individual becomes infected. Guidance from the CDC should account for this uncertainty while providing actionable recommendations with what is known. Based on the information from that meeting and the tripling of travel-related cases in the following week from 3 to 9, on February 3rd, Governor Rick Scott issued an executive order directing me to declare public health emergencies in the counties with diagnosed travel-related cases. And on that same day, I declared public health emergencies in the 4 impacted counties at that time and have since added counties to the declaration as I've shared. The public health emergency included 3 key directives. 1, notification of Florida's Commissioner of Agriculture, who oversees the Office of Mosquito Control, which connects with Florida's local mosquito control boards. Next, mobilization of local leaders to coordinate mosquito control efforts and public outreach to vulnerable populations, with meeting summaries and action plans reported back to the Department of Health. And finally, outreach to medical professionals with up-to-date CDC guidance to increase awareness and access to diagnostic tools. As a department, we established an incident command team to address comprehensive readiness activities. Florida has one of the premier state lab systems in the country, with a central laboratory in Jacksonville and branch laboratories in Miami and Tampa. When the public health emergency was issued, Governor Scott recognized that with over 20 million residents and over 100 million tourists annually, Florida must stay ahead of the possible spread of the Zika virus, and that our lab capacity plays an essential role in that effort. He called on the Florida Department of Health to have on hand at least 4,000 viral tests, which are commercially available and were ordered the next day. Governor Scott called on the CDC to provide at least 1,000 Zika antibody tests so that we could test individuals, especially pregnant women and new mothers, who have traveled to affected areas and had symptoms of Zika. The antibody test allows the state to see if individuals ever had the Zika virus. At that time, we had a capacity for only 475 tests. On February 9th, the CDC provided Florida with 950 additional antibody tests, bringing our total to 1,425. So with our existing lab infrastructure and the needed testing resources, we are now equipped to work with medical professionals to test patients with symptoms of Zika virus and associated travel history to an impacted country based on CDC guidance. The Florida Department of Health licenses all Florida medical professionals and has existing communication channels with our licensees, and we've used these channels to share CDC guidance on the disease, treatment and testing protocols, as well as recent FDA recommendations regarding blood donation from individuals who have been to areas with active Zika virus transmission. Healthcare professional safety has always been of paramount importance, and we have emphasized CDC guidance that universal precautions provide the appropriate level of protection. On February 12th, at the request of Governor Scott, the CDC hosted a conference call for Florida medical professionals to provide information on the symptoms, treatments, and proper precautions for Zika. Nearly 600 medical professionals and healthcare facilities dialed into the call to hear directly from the CDC on the measures they need to take to help patients. Strengthening the connection between healthcare professionals and the public health system is essential for tracking and containing disease, and we remain in frequent contact with the CDC and FDA for the latest guidelines on how best to prepare communities in Florida. Finally, public outreach. We work to keep the public informed as one of the best ways to calm fears and educate for action. At the direction of Governor Scott, we've established a Zika virus information hotline for Florida residents and visitors, as well as anyone planning on traveling to Florida in the near future. We want Florida residents and visitors to have access to an open line of communication to receive the latest updates, have their questions answered, and get advice on what steps they can take to protect their homes and families. We issue a daily press release with up-to-date diagnosis counts and tips for Floridians on how to protect themselves. We've established a web page with links to CDC guidance and public information on community meetings. We've developed infographics to explain clearly what the virus is and the best practices for mosquito protection. And these materials have been requested for rebranding by other states. And we've made materials and presentations available to our 67 county health officers as an integrated Department of Health to inform community stakeholders and partners. We're sharing 3 key messages about Zika virus. 1, anyone who's pregnant, intends to become pregnant, or might become pregnant should not travel to a country with active Zika virus transmission as determined by the CDC. 2, travelers from Zika-infected countries should have protected sex for at least a month upon returning to the United States due to the lingering presence of the virus in various bodily fluids. And 3, the best way to prevent Zika and other mosquito-borne viruses is through mosquito control, which includes individual responsibility to eliminate any sources of standing water where the mosquito can breed, to use mosquito repellent and cover with proper clothing, and to ensure that window and door screens are in place and intact. Our residents play an important role in helping prevent the spread of mosquito-borne viruses, and we want them to have all the information they need to join the effort. In Florida, we have developed a proven, seamless model to take CDC guidance from the federal government and get it to our residents, our visitors, our health professionals, and partner organizations to protect them from emerging mosquito-borne diseases. I'm confident that our history as a department has prepared us to address this issue. In the past, we've had success in containing other mosquito-borne viruses, such as chikungunya and dengue, with systems of readiness that mirror the level of preparedness that we currently maintain. We've made it a priority to stay ahead of the possible spread of the virus in Florida, and we will continue to do all we can to keep Floridians safe. Thank you.
Thank you, Dr. Armstrong, and we'll now hear from the representative from the U.S. Olympic Committee, Dr. Moreau. Welcome, and you're recognized.
Thank you, Chairman Micah, Ranking Member Duckworth, and the other members of the subcommittee for holding this hearing on Zika and U.S. governmental preparedness. The USOC recognizes that Zika is a serious global health concern and an issue that we are proactively addressing with Team USA. The U.S. Olympic Committee is a sports organization. Our mission is to support U.S. Olympic and Paralympic athletes in achieving sustained competitive excellence while demonstrating the values of the Olympic movement, thereby inspiring Americans. Every 2 years, we bring Team USA to the Olympic and Paralympic Games. In between games, we work very closely with 47 national governing bodies of sport to build Team USA. The safety of our athletes and staff is our #1 priority. As the Managing Director of Sports Medicine for the U.S. Olympic Committee, my mission is to build and coordinate a complex network of medical doctors, healthcare services, and academic experts across numerous medical fields. The U.S. Olympic Committee is not an organization with a focus on the specialty of infectious disease. We rely on the tremendous expertise of the Centers for Disease Control and Prevention and other public and private infectious disease experts to address and help us to understand the threats that viruses such as Zika pose for our athletes. We have been in regular contact with the CDC and other experts for months. They continue to provide us sound recommendations based on the information available to date. We have supported these recommendations, developed a protocol to mitigate risks, and provided this information to all potential Team USA athletes and support staff likely to travel to Rio before and during the Summer Olympic and Paralympic Games. I've submitted the most recent USOC communications to the athletes with this testimony. Working with the CDC and other experts, the USOC has developed a protocol to mitigate the risks posed by Zika. Let me walk you through that right now. We're continuously communicating the latest information to our athletes, staff, and other stakeholders. We are steadily communicating with partners such as the International Olympic Committee, the World Health Organization, the CDC, Department of Defense, and infectious disease specialists. We are monitoring evidence-based sources for information regarding viral pathogens. We are following the mosquito bite precautions as provided by the CDC. We are following insect repellent selection as recommended by the DoD. We are maintaining awareness through our partners regarding new interventions as they are identified. We are training our medical team regarding the early recognition and interventions for viral infections such as Zika. We are stocking our formulary with the best supportive medical interventions. We are providing DEET-containing insect repellent for personnel issued prior to departure with additional supplies on hand in Rio. We are considering pretreatment with permethrin kits for all USOC personal clothing. We are also considering providing bed nets for all personnel, and we are identifying Brazilian locations for additional support regarding viral pathogens. In conclusion, knowledge about Zika virus is growing on an almost daily basis. We are following all of the developments. We are incredibly pleased with the support and collaboration that we've received from the CDC, the DoD, and others, and are indeed indebted to them for sharing this information so that we can provide the best, most accurate information to our athletes and staff who most directly serve and support our athletes. We will continue to work closely with the CDC, the DoD, and other infectious disease experts throughout the Rio Games, and we will continue to follow the CDC recommendations. Thank you again for the opportunity to address this important issue.
Thank you, each of our witnesses, for their testimony, and we'll turn to questions, and I'll begin. Dr. Schuchat, can the CDC confirm what I said earlier, that we have not had a case of Zika infection from a mosquito in the United States? Everything is coming in so far from another source. Is that correct?
For the 50 states and the District of Columbia, that's right. We do have cases in Puerto Rico
okay.
and the territories.
Okay, so Puerto Rico and the territories,
and
Virgin Islands.
Virgin Islands and American Samoa at this point, I believe they're,
Okay. But
continental U.S.,
continental,
50
everything.
states, not yet.
Now, the next thing, and I just became more concerned as I heard Dr. Armstrong reveal the issue with pregnant women, and we think there's a link, a pretty good link to some birth defects. And this is a transportation oversight subcommittee along with other things, but these people are coming in mostly from Latin and South America by air. Are there warnings now to people coming in? Is everyone getting a warning who comes in, particularly women? I'd be concerned. When I read all this testimony last night, it seems like the women are the most at risk. We don't know. But are they getting a warning?
We've been working very closely with the air travel industry and other travel partners, so there is signage and so forth.
I think that, again, it would be good to send out something that, and that the airlines that cooperate, they always cooperate. We've had the bird flu, we've had other Ebola, others. But I think we need to get a warning, and it's not that many coming in. We know where they're coming in from, but the infected areas, that there be some kind of warning to the passengers. We do know that there's this, and I'm not technically qualified, I give the wrong terms, incubation or whatever you call it, period, the period of vulnerability from 21 to 30 days. That's pretty much agreed on, Dr. Fauci? We think? You just stopped saying, you said stop having sex for 30 days or something like that.
Infected, you will clear the virus within 7 days,
Okay.
usually, and therefore for the rest of the time, generally, except if you're a male and it could be in the semen, which has been demonstrated in a number of individuals.
We don't know how long that's
We
active.
don't know. It's been in some, unfortunately, as far out as 62 days.
As far as what?
One was 62 days, but that's maybe an outlier, but we don't know how long it can stay.
Well, again, I think the first thing is getting the warning out there.
Right.
These are people coming into the United States from infected areas. So that would be my concern, and we need to work with the aviation industry to get these warnings out there, particularly among women, and then advise them of the risk that we know so far. Okay. I have a release from the governor's office just a couple minutes ago, 227, asking the Center for Disease Control for another 250 kits to test for Zika virus. Are you able, now you've already cooperated and you guys have been there, Dr. Armstrong, the requests have gone in. Everything's been done in a timely fashion. Are we able to meet this request and where are we in the stockpile of making certain we have the test kits?
You know, we have been working around the clock to produce kits and to develop even better tests. And one of the reasons for the emergency request is the volume. We estimate about 500,000 pregnant women will be traveling back and forth to affected areas this year, 35,000 pregnant women in Puerto Rico alone. And so keeping up with that volume for the state support is one of the reasons for the emergency request.
But do we have the test kits now or ordered? Is there, you just said there may be a big need.
Yes,
Our job is
absolutely.
to stay ahead of the curve,
Yes.
and your job. Do we have the test kits? Like, here's one small additional order, and can we meet additional? Where
we are right now.
You have the
is
orders in.
We've produced about 30,000.
Okay.
And we'll have about 90,000 shortly.
Okay,
So we're
okay.
working round the clock.
Okay.
And we're
Now, the
actually
other-
working with private partners so that they can help us scale.
Okay, so we're alerting, we're going to, if we haven't, we're going to alert people coming in. We're going to work with you on that. I want the test kit, we want to make sure we have test kits available and the supply. The thing that startled me was the blood supply, because this is in the blood. We should also have a warning about, there ought to be 60, 90 days, a warning that people should not donate blood or identify that they've been to a country where they've been exposed when they're coming back.
Yes, the FDA has, actually voluntarily, the blood banks did that with a month, self-deferral within a month, and the FDA instituted it formally. There's also effort now in Puerto Rico to import blood because the virus
They
is
think it might
spreading.
be in
Yeah, because they can't assure that local blood will be okay.
and
But
is
there's
FDA
also-
giving a proper warning? I mean,
Absolutely, the
God bless
FDA
the people of
yeah.
Puerto Rico. They should, have some
And there-
transparency in the blood supply,
Right.
truth and.
And there's a accelerated effort to develop screening tests so that blood can be assured to be safe in endemic locations.
Okay, now, you guys have been great in identifying the course forward. I've got a couple of quick questions. Where the testing, and you're trying to get more advanced tests, and a lot of it evolves around the president's request. It was a good request. I just read it. Where's my president's request here, guys? Here it is, from the White House to the Speaker and all the members. And he asked for about $1.8 billion. Now, coincidentally, and I didn't know this, I have a letter back from Mr. Rogers, the Chairman of Appropriations. There's about $1.8 billion available with leftover money from Ebola. Do you have the ability to move that money into where we need it? I'll ask both of you,
Sure.
CDC, NIH.
A couple key points about Ebola. The outbreak is out of the headlines,
Yeah.
but there is still substantial effort. Last month,
But you still have a balance of about 1.8 or $9 billion.
the CDC doesn't have that large a balance for Ebola. Our Ebola resources are either committed or.
Well, the administration does have, again, from from Mr. Rogers, the chairman of Appropriations, is saying that that's unexpended dollars. My whole question is, there's some money available. Do you have money to address this now? Are you short?
The resources for Ebola are committed. They're global health security
No, but-
resources,
okay, then
which
do
are
you have
fully
resources now?
programmed.
I mean, we do a lot of things around here by executive order. We shift money. I mean, that's in a nanosecond, you can see the president or the administration shifting money to some cause.
Right.
Do you have that ability to get the test kits and then I want to ask Dr. Fauci, because you've got a whole bunch of things in research. It was fantastic news to hear the summer trials by this summer. You're moving ahead, and you showed us how you're doing that. But I want to know and assure these members that you feel that you have the resources and support from the administration to move forward. Do you, Dr. Fauci?
Our proportion of the Ebola money, we have.
Well, you have Ebola and you have other money.
No, but I'll explain to you what we're doing. So our proportion of the Ebola money, we've essentially spent all of it except for maybe $9 million. So we've obligated almost all of our Ebola.
You have other sources.
Our sources right now, without the supplement that's been asked for by the president, is moving money out of doing other things. So let me tell you what we've done. We have money that we have been investing in contractors and grantees who do flavivirus research, both in the United States and Brazil. We've now directed them to switch over and add on.
They're under contract to address this.
Right, yeah, but they're going to have to not do other things in order to do that.
And do you have people under contract?
The global commitments have been made to 17 high-risk countries in Africa and Asia, which are very vulnerable for exactly what happened with Ebola.
But you're directing some of those funds now to Zika. Is that 17 countries you're talking about, or something else?
Those resources are for African countries.
But for what? Ebola or for other diseases? All of the above?
Prevent, detect, and respond to threats, including.
So
should
it
they have
could be Zika.
In those countries, they're not having Zika. So essentially.
Well, it is in different.
Right,
continents.
exactly. The geography of that global
And
funding
do
was
you
for
intend
the
to
most vulnerable.
redirect some of that money now that we have this?
We think that would be terribly dangerous in terms of the outbreaks that are
Okay,
ongoing.
again, what I'm trying to get is to make certain you have the resources, and if you don't have them, we need to know. We need to know that also the things that need to get under contract are under contract for the test kits, for the research, for the vaccine, for moving this little protocol forward, Dr. Fauci.
Yeah. So, Mr. Chairman, so just so that I can clarify, in order to get a jump start, we took money that we had allocated for things like dengue and moved it over. I will not be able to proceed with the trial that I described to you without additional money, which is one of the reasons why.
That's what we need to know. And
I
we need
won't
to go
be
back.
able to do that without additional money.
We need to tell our colleagues,
Right.
the request is in, the President gave it to us last week, and we'll have to work with our leadership, but we want you to have the funds available. We don't want to neglect important research. And one of the reasons I voted for the omnibus is we have additional money in research. I was told Alzheimer's and some other disease, you can't rob Peter to pay Paul.
Our summer plans are dependent upon the supplement.
Okay. All right. Well, again, I have other questions like notifying our DOD and overseas personnel through state and DOD. Are there official notices going out on the risks and the warnings and all of that?
Yes, we've been working closely with those other departments for the Americans overseas.
We got families
Absolutely.
and everybody out all around the globe. I've gone over my time. We'll come back because we've got plenty of time, as you can see with the members that are here. Ms. Duckworth, I'll yield to you, and thank you. Thank you.
Thank you, Mr. Chairman. Dr. Suchat, I want to sort of build on what the chairman was talking about in terms of notifying travelers that they're coming back into the United States. I'm wondering about the travelers in the United States who might be on their way out, or what information is being provided. What guidance has the CDC provided to the obstetric community in the continental U.S. regarding Zika?
We've been working very closely with the clinical community, including obstetricians. We've developed joint guidance. We've used the obstetricians' website, in fact, has distributed our guidance broader than we've been able to the 65,000 obstetricians in America. And we've held calls and sessions for question and answers. We are very keen to be letting women know before they travel, and the signage and the outreach is through both direct health clinician channels and through consumer groups as well. I did a scary mommy blog, and we've been really working all the social media as well as the professional groups so that women know and that their families know what to expect. We know that women's most trusted source is their own doctor, and so we want their own doctor to know the answers to the questions. With a breaking syndrome like this, information is updated frequently, so it's not just a one-time guidance, but ongoing updates.
Is that a similar effort with, I guess, family physicians or groups where, I'm thinking if these countries, if I were traveling to them, I would need to get immunized for a range of other diseases before going anyway, and if I was planning a trip, I would be going to get those particular immunizations. Is Zika also then being added as part of the conversation?
Yes, that's right. Our travel health site is the most popular site on CDC's website, and we work really closely with both the clinical community and the special travel health and travel industry to make sure that people know what to expect where they're going, what to eat and drink or not, and what shots they might need before they travel. So Zika has been added to those messages.
Thank you. Dr. Fauci, I'm a big fan of the NIH and the work that you do, and I certainly think we should be funding you at far higher levels because it's money, it's a savings, it's an investment. Do you know if there's a specific stage during pregnancy when exposure to Zika is more likely to cause microcephaly?
We don't know for sure, but if it acts like virtually all other viruses that cause congenital abnormalities, the first trimester is overwhelmingly the most vulnerable. Whether or not individuals who might get infected later on in pregnancy have a degree of adverse event with the pregnancy, it's not entirely clear. I wouldn't be surprised if there are some outliers in which you can have late effects of infection later on. But when you think about this, almost always the first trimester is the most vulnerable.
And I understand that the severity of the birth defects caused by Zika do vary.
Very much so. Yeah.
And do we have any idea what causes the variance? Is this all part of the learning process that we're in right now?
It's part of the learning process with regard to Zika, but again, you use other models like rubella, CMV, and others, and there isn't just one size fits all. You have a great degree of variability, and it's not surprising that you might have something as severe microcephaly to the point of the fetus not even surviving, or you might have birth with just some abnormalities of vision or perhaps some mental issues. So it goes from one end of the extreme to the other, and it's probably just the variability of the penetration of the virus through the placenta to the baby.
Are those mental issues, do those also include mental illness like schizophrenia or bipolar disorder?
There has been reports in the past, not with Zika yet, of infections that mothers have during early parts of pregnancy and what is apparently an increase in the incidence of certain types of disorders. There is some controversy about that, but there's enough information to suggest that there would be an impact on some aspect of brain function, which might also include things like psychiatric issues.
Okay. Dr. Suchat, I think you might be the organization that works with the DOD, perhaps. What about military women that are being deployed, especially? I served in Operation New Horizon multiple times and various missions in Latin America. What are we doing with DOD, with military men and women who are going over?
Yeah, we've been working closely with both the military and the Department of State so that our guidance for Americans traveling abroad can be consistent for the military that are serving abroad, as well as for the State Department employees and their families. So we do think that in places where there's active circulation of Zika virus right now, particularly Latin America, that the ability to, that it's not good for pregnant women to be there, and if they're interested in redeploying elsewhere, I think the departments are working with them on that.
Is there any plans to do any type of universal testing and monitoring of troops who are assigned there? Most of these are going to be Reserve and National Guard troops also. So they're going, they've been planning, they're going to go, they're going to do their 3 weeks or their 1 month and they come back. But it is a nice population that you can track who will go and come back and.
Yeah, absolutely. One of the aspects of coordination across the government is the intergovernmental leadership calls that we have, and the DoD is very actively participating in that. They do enormous amounts of research and monitoring and force readiness, so I'm not personally aware of whether there's deployment tracking in terms of, cohort studies going on, but that is the kind of thing that they're able to do.
Okay, thank you. I yield back, Mr. Chairman.
Thank the gentlelady, Mr. Desalegn.
Thank you, Mr. Chairman, and thanks to the ranking member for this really interesting hearing. And first off, congratulations to all of you. I'm always very proud of the fact of our robust public health system in the United States. I've worked in local government and state government. Works best when nobody notices. But in this global economy with pandemics, always something we have to be cautious about. My questions are 2 lines, really, of questioning. Dr. Fauci, first of all, how would you characterize the American role in global pandemic preparedness? We are looked at both because Americans travel a lot, but because of our infrastructure as a leader in this. How do we interact with the global community to make sure that we're using our resources in an effective and efficient way, given our position?
I think we interact quite well, and it's getting better and better. Every time we have a challenge, there are really lessons learned that I think are important. Everything from responding to a pandemic influenza or the threat of a pandemic influenza to the global response to Ebola, in which there were several lessons learned. And even now, all of us are experiencing, like Dr. Schuchat and I were very much involved in the issue with Ebola. And as people who are now involved very deeply at the issue with Zika, we already see the differences in how the global community has responded in a much more robust way than we did before. So the answer to your question is I think we've done well all along, but we're really doing better now because of experience.
So the global preparedness is going up exponentially,
I
unfortunately,
believe,
as you get more incidents.
Yeah, I believe so. And we have a global health security agenda that we're part of, the United States is part of, which is also part of that preparedness issue.
Doctor, you have, from the CDC's perspective?
Yes, I think people are taking the issues of preparedness very seriously, and the importance of being able to prevent, detect, and respond everywhere is vital. So the U.S. is a leader in that, but we've now got many other countries joining in the process. And the WHO, of course, did jump on this a lot quicker than previously.
So my other line of questioning is similar to the ranking members. Dr. Fauci, I'm told you were involved when the AIDS epidemic first began, and being from the Bay Area and being old enough to remember that, even in the Bay Area, as we were dealing with that, and researchers at places like UCSF were dealing with it, many of whom are still practicing. The miscommunication was a huge struggle. The things that people would say, both politically in terms of our effectiveness. But now, all these years later, you still have that, but then you have social media. And I'm just curious, you spend a lot of your time, I imagine, correcting misinformation, and how much, if you'd like to talk about that, about what you're learning about how we communicate vis-a-vis social media, and what time you have to expend maybe correcting what's out there. And has that changed over time?
Well, part of the administration, and in this case the Department of Health and Human Services, which are the predominant agency involved, is that we try very hard, all of us, to get out there publicly with the media, both the classic media and the social media. Myself and Tom Frieden and Ann Schuchat, we're on the media all the time, TV, radio, et cetera, trying to get the information out. And what we've learned all the way back from the years of HIV/AIDS is that we want to get correct information out, and when we don't know the answer to something, we say we don't know the answer. And that's the reason why you're hearing us be very cautious, for example, of saying we believe and think that there is a direct causal relationship between infection of a pregnant woman and microcephaly, but we haven't yet done the definitive studies. And the reason we don't want to say anything definitive unless we do the study, because there may be other cofactors that are involved that we don't know about. And if we come out confidently saying something and then it turns out not to be the case, we lose credibility. So we're very careful to only talk on evidence-based as opposed to guessing what we think the answer is.
From the CDC's perspective?
Yeah, we think that the changes in communication have both benefit and harm. And so, of course, it's much easier to reach a lot of people, but that means it's much easier for everyone to reach a lot of people. And so the credibility of the public health folks doing the talking is critical. We really want to protect that.
Yeah, I think we're all aware in our world about the benefits and the curses of social media. Mr. Chairman, I'll yield back the balance of my time. Thank you very much.
Thank the gentleman. I have a few more follow-up questions. Okay. We have people in the United States who were infected. They were infected outside. Right now it's winter across the United States, and we're getting into more of the mosquito season. Do we know if the disease can be transmitted from a mosquito biting an infected person? Dr. Fauci, do you know? So we're gaining in the number of infected people in the United States. It's in their blood, and a mosquito bites them. Then we infect the mosquito population here.
That certainly can happen, and what...
I'm not a scientist.
No. Well, certainly that's the way it is spread now in the areas where there's local transmission in South America and the Caribbean. We have those mosquitoes in the United States, particularly in a certain region in the southeastern part along the Gulf Coast. And one of the things that we're preparing for is that we have, as you've heard from Dr. Schuchat and others, a considerable number of imported cases that got infected elsewhere and come home. Right. We're going to see more of those. What will not be surprising is that sometime in the future, we will see local transmission where just what you're saying happens, where someone comes back, they get bit by a mosquito and transmit
others. The way
others.
you stop that is you stop the mosquito.
Right.
Like we've gone after West Nile. We had West Nile right here in Washington,
exactly.
D.C.
So it's enhanced mosquito control, and that's exactly what the people in Florida do.
Now, that's mostly a state and local issue. I don't know if we are helping any of those local entities or if they can use their funds. We have CDC funds, and that's not CDC funds. We have, what is it, community block grants?
Quite a bit of the emergency request is to be able to support state and local mosquito control. Mosquito control is very patchy right now, and there aren't resources.
In Florida, we're damn good at it.
And we're all
we've
grateful
had mosquitoes, and well, most of the Gulf Coast region and you go. I've worked in Louisiana along the Gulf Coast to Texas, and they're pretty good at it. But again, there are places that are not as good at it. And the reaction that Florida has taken is, Florida set a model already for the United States. But what we want to do is make certain we're covering the rest. It sounds like we've already had a little damage in Puerto Rico, the Virgin Islands, and some of the Caribbean region.
Yes, the living conditions and the climate in Puerto Rico and the Caribbean are such that the mosquitoes are very intense, circulating year-round. In areas that actually have good mosquito control in the U.S., the type of mosquito that we're dealing with here is a bit difficult. There are a variety of species, but the Aedes aegypti mosquito is a daytime biter. It's inside and outside.
So
it bites on
there
many
again,
people.
Public information for folks in the continental United States. You've got to use insect repellent. The local authorities and state have to do more spraying. We can't leave. I've seen some of the recommendations already. Even small amounts of standing water are breeding ground for the coming spring and summer.
And it just may need to be more intensive mosquito control because this one is quite difficult, particularly, as I mentioned, in Puerto Rico.
Now, you didn't mention this, Dr. Moreau, but I read about it and didn't think about it. Did you mention that the games are being held in Brazil in their winter? Did you mention that? It might have been in your written testimony. But folks don't know that, which means that you've got the best chance of not getting infected in Brazil, where your Olympics are being held. Is it in July or August? I forget the dates. What is it?
The August for the Olympic Games,
And that's
September
about,
for the Paralympic Games.
that's some of your coldest months down there. So you've got your least likely time of being infected. For folks that want to go to, you know, we want our U.S. team to participate, to be protected, and we want our visitors also to have that. But every time you get a chance, Burrow, you need to tell folks that you got the least chance of being bitten or infected during that period of time, because it's the opposite of the the northern hemisphere. Okay. Okay, DOD has already done a lot of work. How do we, how have we been coordinating with DOD, Department of Defense, for anyone? Can you tell us, CDC?
Maybe I
or
can
Dr.
begin and Dr. Fauci
Okay.
can continue. There's quite a bit of intergovernmental coordination across the leadership to do the planning, both for force protection. There's also a lot of research that DOD does.
Yes.
And they are part of our countermeasures.
So we're not
Group.
duplicating?
No, and same with the Ebola research. You know, one of the promising vaccines was developed originally through
Right.
military work. So I would say the coordination is good.
What would you say, Dr.
I
Fauci?
totally agree. In fact, we've worked with the DOD on a number of issues, the most recent of which was Ebola. We'll be doing it here. And we have very good coordination, and it comes centrally. I mean, we coordinate within HHS, but through NSC, we coordinate among all the agencies.
Okay. Well, at this point in the record, and with your permission, Ms. Duckworth, I'll enter in the record, and we trying to get everybody who's involved here, their testimony. And we asked DOD, who is not a witness. We have testimony from the Department of Defense. We have testimony from U.S. Agency for International Development, and testimony from the American Mosquito Control Association. And the gentlelady moves that this be made part of the record without objection. So ordered. So we'll put that in the record at this point. Because, again, I've got two federal agencies here, and we've got the state witness and then association here for our Olympic committee. And we need to know that we have a coordinated and seamless connect with all of our agencies. Did you want to comment any more on DOD? Okay. I just saw here that there's research outside the United States, a British technology company, I don't know the name, is currently testing genetically modified mosquito famous mosquito named OX513A in Brazil. You're aware of this, Dr. Are we doing anything with these folks?
Yes, we are. We actually, the idea of genetically modified mosquitoes, which you make a male sterile and release it into the environment, is something
And
that
they
is being-
released some of these on an
Yes,
island already?
they have.
Okay.
The release of genetically modified mosquitoes in order to prevent the procreation of other mosquitoes is something that has been tried in local ways where you would go into a relatively restricted geographic area, and it seems to be rather effective at a local level. The challenge with genetically modified mosquitoes, in addition to somewhat of the societal pushback about anything genetically modified being released into the environment, is that it's difficult to scale it up on a countrywide basis. That's one of the problems we have with that.
Okay, and then, again, I'm just trying to find out if we're covering all of our bases here. Then you've got, I'm learning more as we go along. You recommended CDC, some of the insect repellent, and I just found out, I didn't know they had this. This is insect repellent for clothing and gear, and our all-knowledgeable ranking member who knows about DOD said, yes, they have this, but they also found it causes cancer. This seems like a good product, and I go down to like Puerto Rico all the time. one of my favorite places to visit. Just came back after the holidays. But is this stuff good to use, and are you guys recommending that? CDC, tell us if the cure is worse than the disease.
We work really closely with the EPA, who registers insecticides and repellents and so forth. And so our website has a link to what is okayed and what is not. And so there are many repellents, and then there's the permethrin treatment for the clothing, which some of the products are fine, and I can't
The
see that
staff
far.
said that you said this is okay.
Okay, if
But
that's
I'll
the one
also
that's
be
okay, then it's
conscious
probably
of
okay.
the warning of my very knowledgeable
I had to swear.
ranking.
We used to soak our uniforms in it.
She says they used to soak their uniforms in it. I'd never heard of it, but it's just interesting.
Right, we
And
actually-
again, getting information out to people how they can protect themselves is so important. So we've covered some of that. I was kind of shocked the first time I've heard your 62 days, at least for the males, to possibly be infected and have pose some risk. I've not seen that before. Is that the first time you've announced it today?
That report has been out for a few weeks now, but
I've not
remember
heard
that-
it publicly.
Yeah, right.
I've heard
Yeah.
21 to 30 days
no.
advisory, which is a different situation, but I think we need to be aware of that. I
Yes.
appreciate your making it known publicly. Dr. Armstrong, well, you haven't been neglected, and we appreciate your coming here. Okay, you're at the other end of the spectrum. I've gotten good report from our local health officials and the quick response from the governor, the quick response from you, the state level. Tell us, candid, I know it's awkward having CDC and NIH here. Is there something we're missing? Is there something you could recommend that we should pay attention to from the state level and local? You're on the front line.
Well, thank you for your question. We have to manage this situation in the state and locally with what we know. And what we have appreciated is guidance from the CDC now that is acknowledging uncertainty and what we don't know and helping us to really provide insights for people out of an abundance of caution so that we keep them safe. And I think that's been a key change from Ebola to Zika, that there is acknowledgement by the CDC that just because they don't have a definitive answer to something doesn't mean something doesn't need to be said. We still need a guideline. And we, again, are leveraging all of the CDC guidelines to protect the people of Florida and our visitors.
Okay. A follow-up to my question to Dr. Fauci about the genetically modified organisms. I guess there was some efforts in Florida to curtail some mosquito-borne threats in Florida using that approach. Are you aware of that?
Yes, I am aware of that in the past, and I think that
That's a route we should take? Was that successful? What did we use that on? I don't recall. So,
I'll have to get you the specific virus against which we were using a mosquito approach. But I would echo what Dr. Fauci says. I think there needs to be a great deal of public awareness and education before doing that. And we need to be aware of unintended consequences from introducing genetically modified mosquitoes.
now, the other thing is you're at the state level, you're at the federal level. When I spoke with our local, one of our local health directors, he said, we get these cases, he says, and we're also responsible for monitoring the individuals who are infected. He says, well, we have very limited staff, and I need people then to be the monitors. And as you get multiple people, you need multiple staff checking up on them. So some of the resources to the local entities to actually monitor these folks, it appears it might be putting a strain on them. Do you have a way of dealing with that? Do we have some emergency funds at the state level to make certain that folks who are infected are monitored?
Well, at this point, we're applying what we learned through monitoring for Ebola virus. We had a very
Yes.
aggressive program.
They told me, actually, and listen to this, he says, one way we would go when they thought someone was affected with Ebola, he said they'd come with a sign and what's your temperature? He says, because you didn't want to come in contact with them. That was a different situation, but you have to modify your approach to the risk, even for the worker. But my concern was the funds to make certain you have the workers who can go out and monitor these folks. Right now, these are very limited numbers, but we'll have to make certain at the state level or on an emergency basis, if we see where we've got to have additional personnel, that need is met. So I think those are the major questions. Again, we have some serious issues here. We've done, or you all have done, we've done nothing yet, but you've done a great job in staying ahead of it. Usually this committee is very harsh on folks, and we had some tough time with the start of Ebola and some other issues, but I'm very pleased with where we are right now. We just want to keep it under control and go forward. Did you have anything else, Ms. Duckworth or Mr. Solonay? Well, again, we'll keep the record open for additional questions for our witnesses. Make any responses part of the record today. I want to thank each of you for your good work, for testifying today, and look forward to working with you. And we'll try to pledge ourselves to get the resources that are necessary in a timely fashion. There being no further business before the subcommittee, this hearing is adjourned. Thank you.